How's it going, guys? Past level question for pathology for step 1. 12-year-old boy. He's got 2-day history, progressive swelling of the eyes, no past medical history, vitals normal, and physical exam shows that he's got swelling below the eyes and also at the ankles bilaterally. There's no abdominal fluid wave, no ascites. Complement protein C3, C4 normal. I'll talk about this as we move to the clip. ALT, AST normal, should be under 50. And then he's got proteinuria. He's got no RBCs in the urine. What's most likely to be seen in this patient? Let's just hop through. Antibody, antigen immune complex, subendothelial, wrong fucking answer. Doesn't exist for USMLE. So when we talk about subendothelial deposits, whether it's just complement proteins or immunoglobulins in general, could refer to membranoproliferative glomerulonephritis, which is going to be red urine in a patient with hepatitis C or malignancy. It could be diffuse proliferative glomerulonephritis, which is going to be red urine in a patient with lupus. Wrong fucking answer. Choice B, antibody antigen immune complex subepithelial, wrong fucking answer. Lumpy, bumpy appearance, this would be post-streptococcal glomerulonephritis. Okay, so we know it's wrong because we would have a nephritic syndrome with blood in the urine if it's PSGN. Okay, so very easy way. If you know your nephrotic versus nephritic syndromes, you go through my renal PDF, which I'll link below. You'll obviously be able to eliminate that instantly. Okay, but you'd have red urine 1 to 3 weeks after strep pharyngitis or skin infection. Can be a impetigo, erysipelas, cellulitis. Wrong fucking answer. Choice C, hyaline deposition of the mesangium. Wrong fucking answer. First, a diabetic glomerulosclerosis. Clearly not the demographic that we'd have here. Okay, Kymel-Steele-Wilson nodules. They're hyaline. They look like pink circles on histology. I've made clips on that stuff. So it's a very buzzy image, okay? But diabetes, a point I want you to know is that it's a nephrotic syndrome, not a nephritic syndrome. So you're not going to have blood in the urine. Okay, it's an easy way to eliminate when you're dealing with questions and you're not sure what the answer is. Wrong fucking answer. Choice D, IgA deposition with mesangium. Wrong fucking answer. This is IgA nephropathy. OMG, it's nephritic, not nephrotic. Okay, so you'd have red urine. So IgA nephropathy is going to be red urine 1 to 3 days, not weeks, 1 to 3 days after a viral infection. They don't have to mention the viral infection on USMLE. Okay, I could have given you basically the same question here and just said there's RBCs in the urine and said he had a sore throat like 2 days ago, and the answer would have been IgA nephropathy. I could have said sore throat 2 weeks ago, it would have been PSGN. So it's an important distinction you need to know. With PSGN, and you're probably wondering why I didn't mention this before, but it doesn't fucking matter, does it? You'd have decreased C3. Okay, so complement protein C3 is decreased in PSGN, it's decreased in lupus flares. C4 will be decreased in cryoglobulinemia. I don't really know what to say. It's just something you could know / should know. Wrong fucking answer. Choice C, increased serum LDL, correct answer. It's minimal change disease. We eliminated to get there. Okay, so you just have a kid who's got swelling and he's got some protein in the urine, and that's minimal change disease, aka lipoid nephrosis. And you're going to have no changes on light microscopy, hence the name, but you're going to have podocytic effacement on electron microscopy. They don't have to mention the viral infection. Okay, so it's very easy diagnosis. And you say, well, why the increased serum LDL? It's because in nephrotic syndrome, you can get dyslipidemia, increased LDL, increased VLDL. The liver is pumping out apolipoproteins to compensate for the hypoalbuminemia so that we can maintain intravascular oncotic pressure. Nephrotic syndrome, you have proteinuria, you have hypoalbuminemia, you've got edema, and you have dyslipidemia. That's your classic tetrad. Nephritic syndrome, in contrast, hematuria, azotemia, oliguria, hypertension. You can get protein in the urine with nephritic syndrome tangentially. Okay, so the protein in the urine, absolutely you can get a nephritic syndrome, but you have blood in the urine with nephritic syndrome. Minimal change disease, though, it's your very bread and butter, classic past level nephrotic syndrome that you're going to get in pediatrics. 19 out of 20 times pediatrics, 1 out of 20 times it can be Hodgkin lymphoma in adults. Choice E, correct answer. You know the deal. I'm to make more content. If you like my stuff, subscribe to my channel. Appreciate your time. That's it.